Good morning, everyone. Welcome to this series of webinars on the response to climate to the environment. It's a series of webinars focusing on the link between climate and environment that we call on transdisciplinary training for public policy. Today in particular, we have the first edition entitled Climate Sensitive Infectious Diseases, Dengue, Water, and Environmental Risk. This series of webinars is done in order to disseminate the results of the seed funds funded research for the Inter-American Institute for Global Change Research, and in a joint effort with the Global Consortium on Climate and Health Education of Columbia University. I'm going to now give the floor to Danieli Magalhães from the consortium. Go ahead. Welcome, Danieli. Thank you, Omar. Good morning, good afternoon, good evening to all of the colleagues joining us from different locations in the Americas and other regions in the world. It's a pleasure to welcome you on behalf of the Global Consortium on Climate and Health Education from the Columbia University in New York, and we are joined by our partners in the Inter-American Institute for Global Change Research for this series of webinars. Today's session focuses on a topic that is at the heart of the link between climate and health, climate-sensitive diseases, and in particular, dengue, water systems, and the environmental risk. This isn't just a scientific or public health challenge. It's also a systemic challenge, a challenge for development, and more a first-line clinical reality. Throughout Latin America and the Caribbean, we see how climate variability, such as increase in temperatures, changes in rainfall patterns, and extreme weather events are changing the seasonality, geography, and severity of vectors spread diseases, of diseases spread by both vectors and water. And so this used to have predictable transmission patterns, but these patterns are becoming more difficult and more difficult to control. But something that this session highlights is that these risks are being boosted only by not just by climate, but also underlying vulnerabilities, gaps in access to water, to sanitation, and differences in the healthcare system capacities and social vulnerabilities, which means that our responses should be transdisciplinary and based and tailored to the needs of the community. In the consortium, in the Global Consortium on Climate and Health Education, we have the mission of ensuring healthcare professionals have the knowledge and the tools necessary to face these kinds of challenges, which includes understanding the climate as a multiplier of risk, strengthening training and working on sectors from meteorology to urban planning and community engagement to build more resilient healthcare systems. What is particularly exciting about today's session is the emphasis on solutions that are already being developed and tested throughout the region. The projects you will hear about show the power of combining healthcare practices, community knowledge to implement early alert systems, strengthen institutional capacities, and coordinate locally relevant prevention strategies. They also stress a significant point. Preventive actions in healthcare cannot only be conducted by the healthcare sector. It requires collaboration between the institutions and with the communities. As we move on with the presentations, I invite you to reflect on how those lessons can be translated to your own context, whether it be in research, public policy, clinical consultations, and others. And how can we continue to build a regional and global learning community shared around health and climate? Thank you again for joining us. I hope we can have a very enriching debate. And I will give the floor to Hilma Mantilla, who will moderate this session. Thank you, Daniele, for bringing that context. And I now will give a more specific explanation on where the projects we're presenting today comes from, because we have a very broad audience and that doesn't necessarily involve the people who participated in the process. So I will share my screen. There you can you see my screen? Yes. And so as Daniele mentioned, this is the first session of a series of webinars around the link between climate and health. In the Americas, we have this issue of climate-sensitive infectious diseases. And so just so we're clear, the projects presented today began in 2022 with a call we made for proposals about health and climate with a transdisciplinary approach. And so we would like to tell you how in this project we did a training so that everyone had the necessary tools to use a transdisciplinary approach, and also have their tools to improve communication and have a good communication process at the interface between political policy and science with genuine participation of communities. And so we will tell you about what each of the groups that participated in this call worked on. We have had the goal of building a network of regional experts on this transdisciplinary approach. And I will tell you a bit about our criteria for selecting the projects and the people who participated in it. These were the results. You can see we started in 2022 with a course on transdisciplinary science and for people to understand what it involves. And you can see we had 170 participants from 15 different countries, 10 facilitators, and 26 transdisciplinary teams working. And we were able to get 18 pre-proposals, of which 12 would be pre-selected. And we had those 12 proposals selected with 134 researchers. 10 out of the 12 principal researchers are women. 4 out of 12 are early career scientists. And we got $254,000 in funding to conduct the projects that you will learn about. And we also were able to manage to get $297,000 in co-funding. And then we had an in-person event in Neuquén in Argentina, where the facilitators met all the researchers, and there were also some government officials that were there to provide feedback on the projects. We had 12 projects in total. You have a list of those that received funding here, the countries that were involved, and the funding that each of those got. And so today we're going to present 4 of these projects. Here you can see each of those and the team, and we're going to start with community engagement strategies for dengue prevention, which involve 2 countries, Argentina and Colombia. And we have Elizabet Estallo from the Institute of Biological and Technological Research, and we are also going to have Doriam Camacho from Colombia presenting on this. Then we have Gustavo Estrada from the University Rafael Landívar from Guatemala, and Rocío Sánchez from the Regional Ecology Institute from Argentina. And the topic is an assessment of the institutional capacity in public health to respond to arboviruses in the context of climate change. We're going to have approximately 10 minutes for people who are here to ask question. Let me remind you that on the bottom of the screen in Zoom, you're going to find an icon with a Q&A, or if you don't find it right away, you can click on more and it will appear there. And you can put your questions there so that each of our presenters can reply. If you're not able to get to all of the questions today, we can maybe perhaps get them at the website. Then we have Yesenia Linares from the Meteorological Center of Habana-Artemisa-Mayabeque on the early alert system on dengue. And then Bertha Pineda from Peru and Mauricia Mesa to discuss multidimensional vulnerability to dengue and diarrhea in the context of climate change. So I welcome all of you again. We have an interpretation into English and into Spanish. If you want to, you can access that at the bottom with the icon at the bottom of the page. Without further ado, I will give the floor to Elizabet to begin her presentation. Good morning, everyone. As they were saying, we're going to present on this community engagement strategy for the prevention and handling of risk factors in the spread of dengue with a perspective on climate, environment, society, and culture. And this was conducted in 2 countries of Latin America, involving the institutions we belong to, such as CONICET, the National University of Córdoba, the Municipality of Córdoba, the Municipality of Magdalena, and the Global Climate and Health Alliance. This was the team, and so we were able to conduct this work thanks to our transdisciplinary work addressing this issue with decision makers and also members of academia. We had a temperate area in Córdoba in Argentina, and then a tropical area in Santa Marta in Colombia, because dengue isn't anymore just a tropical illness. And so we are seeing how public health is being reconfigured around climate changes. And we have dengue circulation in Santa Marta throughout the year, and we did a research in this period. And so we need the virus, the dengue virus, to enter the city and circulate around the city for our research. And so what we looked at was the increase in cases that are caused by meteorological variables using satellite images. And we looked at outbreaks in Córdoba and some outbreaks in Santa Marta. And the models showed that for the city of Santa Marta and the city of Córdoba, variables related to temperature showed a negative association. And so we have the daily temperature with a between 2 and 3 weeks of lag. In Santa Marta, vegetation showed a positive association because of the NDVI vegetation index. And there was also an association between humidity and rainfall. And using satellite images for Santa Marta, because we didn't have data from the meteorological services for that period between 2009 and 2023. In the city of Córdoba, we found that relative humidity showed a positive association with dengue cases with a lag time of 4 weeks.
Now I'd like to give the floor to my colleague, Gloria Camacho, who will resume the presentation. Thank you. To reach our goal number 2, we worked on social and cultural factors that affect preventing risk factors. We held an ethnography workshop in the city of Córdoba. The 2 teams agreed on the field work that we were going to carry out. After the workshop, after work meetings, we held semi-structured interviews, observed participants in each of the cities. Qualitative results. As this was an ethnographic task in each city, Córdoba and Santa Marta. In Argentina, we identified those perceptions about dengue and its impact on daily life. We also talked about a category regarding community dynamics and collective responsibility connected to local health authorities, prevention practices in the community, and these environmental factors and their connection with climate change. Santa Marta. We found some differences in each category within the analysis in Argentina. Connection with health authorities, risk communication, and socially designing solutions jointly with the community. After collecting all this information, we developed a strategy through co-creation workshops held with the local authorities in each of the cities. We had an advantage. Part of the Argentinian team was able to participate in the co-creation workshops in Santa Marta. And also one of our researchers was able to attend as well with decision makers in the city of Córdoba. You have 1 minute. Thank you. All the work done was socialized with a working team, and 5 interventions were developed. The first 3 interventions are shared by the countries, and the numbers 4 and 5, citizen science in schools and educational campaign with a uh, specific support are to be applied in Santa Marta. Elizabeth, transdisciplinary work allowed us to create strategic partnerships among municipalities. We signed an agreement with the School of Exact Physical and Natural Sciences with the municipality of Córdoba, with the University of Santa Marta. We also included the Santa Marta research team in the dengue um, group regarding the government of Magdalena and regarding the Córdoba team, also municipality of Córdoba. This allowed us to work together from the beginning, so we were able to create knowledge, tools, commitment, cooperation, and sustained action throughout the project. We also have community participation, as stated by Doriam, through focus groups, and we talk to neighbors all the time in order to listen to them and co-create strategies with them and with decision makers. Thank you so much. Thank you so much for this excellent presentation. It was very timely and specific. Now we have the second speaker, Gustavo. And please remember, Gustavo, that I will be letting you know that you have 1 or 2 minutes left. Thank you. We can already see your slides, so please go ahead. Good morning, everyone, and thank you. I would like to thank my I colleagues for this opportunity to present my findings and share the experience of this study. As you can see on the screen, in the study, we tried to assess the institutional capacity of public health services when it comes to responding to dengue in the context of climate change. Why this study? Well, basically 4 main reasons. First of all, the marked increase in dengue cases in the Americas. Argentina had a huge epidemic, in particularly in the region that participated in the study, and also given the increase of the climate conditions that are necessary for the vector to prevail, but in particular in Guatemala, areas that previously had cold weather, temperate weather, now have the climate that helps the vector develop. And also there is co-circulation of the 4 serotypes. Also, there is serious risk, and response capacity is very important when it comes to effectively controlling outbreaks. Specific objectives of the study. First of all, assessing the capacity to respond, and we focus on 3 main areas. First of all, the infrastructure of the resources that services have. Number 2, health personnel, in particular the knowledge about the problem, attitudes, and assessing current practices. And number 3, the networks that involve communities. Methodology. It was a huge challenge, in particular because these are 2 countries that have different realities in the health systems and social cultural differences as well. But also the teams didn't know each other. We chose specific places. In Guatemala, for instance, we chose an area where they didn't have the vector 3 years ago. They had the first cases very recently. Also a high endemic prevalence area. And then in Yerba Buena, Argentina, it's an area, it was the area with the highest incidence during the 2023 epidemic outbreak. So research, we chose three approaches. A checklist co-created with health services teams and with teams that do not necessarily work in the health area, but that have to do with municipal response. And this has to do with tools, knowledge, attitudes, and practices, also co-created with services in Argentina and Guatemala. And we also analyzed the networks used in specific software and chose and selected methodologies for socially validating the results. Findings varied. In Guatemala, as you can see in the slide, we can see the main differences between. For instance, one survey, they knew nothing about the problem, and there was another area where they knew about the problem. In green is the area, is the endemic area. And they have specific results regarding diagnostic capacity, knowledge, surveillance, and availability, and the results are higher than in the other area. There were also differences in particular, but this is more structural in nature regarding the general capacities of services and regarding the type of health staff they have, how they organize themselves, and also we have the area where the problem is relatively new. There is a high indigenous population there, rural population as well. So we focused more on coverage than better capacities. And regarding networks, we found weak intersectoral and community work regarding dengue, but that the Yerba Buena results were better in Argentina. But there is a paradox regarding Yerba Buena, because there are high capacities, but despite these capacities that have improved uh, to face the problem, this is where the largest outbreak took place. One of the main problems identified was that the response did not come from the community. It was a municipality that acted as an organization, but the community nor the civil society organizations, they did not react. The debate led to four main relevant factors. Number one, the effects of structural inequality in Guatemala that appeared in the results. Also, the diagnostic gap as a critical vulnerability. It's not enough to have labs. They need to be conveniently placed, something that was clear in Argentina, where there are only 2 labs available for 11 services. Then climate change as an element that helps plan services and trainings, and this must be considered urgently. And also rethinking how preparedness is assessed. You have 1 minute, Gustavo. Okay, then I would like to say that the assessment requires multidimensional approaches, that diagnostic capacity is a priority for investments in services, that the networks are as important as infrastructure, and that the TD approach is essential and not optional. Thank you. Thank you so much, Gustavo. Now let's go to the questions. Thank you. I would like to ask the speakers to please turn on their cameras. Thank you. So we have a first question for Dorian and Elizabeth and their team. In the dengue time series, you show there is a peak of dengue cases in 2023 in Córdoba. Is there a climate or environmental pattern in that year that led to that peak? I'm asking this because in my country, Bolivia, we also had this peak in 2023. Well, the study has information according to each year, but I don't have the results here. Of course, the papers are available. Please read them and have a look at which the causes were. We provided information about most of the outbreaks and surface temperature variance for the day, and this was a variable that was common in all the outbreaks, including the 2023 one. So we may suggest that if there is a higher daily climate variability, this would be a limiting factor to a higher dengue incidence in the region. Thank you. Okay, this question might be answered by both speakers. Which limitations did you find when implementing the project you have shared with us? Well, in our case, the main limitation w- was including non-academic stakeholders in in the research planning stage, which is very important for TD research. The thing is that there are many epistemological issues to solve, things like approaches, for instance, and how you see the world in general and research as well. And including non-academic stakeholders and usually concealed voices in research, that was a sort of first limitation. It took us some time to agree on this with the teams. And it led to fruitful debates regarding the development of instruments, because as we included non-academic stakeholders, we also had the dilemma of deciding on how relevant each opinion and approach was. And we had to relearn how to do this. I think that that was the first limitation, at least. Yes, please go ahead, Elizabeth. Go ahead, Dorian. Okay, we were just saying that at the beginning, we came from disciplines that were so different, and that was a limitation at first, but it turned into a strength because we were able to learn from one another. So these were disciplines with different research methods, and we were able to make the most of interdisciplinarity. So it was a win-win for both teams. Elizabeth, would you like to add something? Yes. Um, as a team, we found a limitation regarding meteorological data. In Colombia, for instance, we did not have the time series between 2009 and 2023, and we were able to just work with the effect of the environment only through the use of satellite imaging. So we used humidity indices, precipitation figures regarding satellite remote sensors, just for Colombia. But in Argentina, we did have information until 2023. I don't know what will happen from now on, but we did have meteorological data because the National Service had a long-standing database. We were able to use those data and satellite data as well. Thank you. There's a question for Gustavo. The population that participated was just the health personnel of the area assessed, or did you include the patients as well? That's one question. And the other one is, did the health area not have a lab there? However, the samples sent to the health area, I'm sorry, the question is not very clear. Let's go to the first question regarding the population included, if it was only the health staff or the patients as well. Both were included in our specific goals, of course. But the capacity to face a problem in health services included health workers. But there was another one that had to do with working in a network with communities. So we approached communities regarding their perceptions regarding climate change. if they noticed any changes related to this. And also, in the case of Nevaskiche, where very recently, where the vector has started appearing recently, we asked if they had any perceptions in this regard. So it was both things, communities and health workers, with different questions, of course. Regarding the health area and the labs, I think the question is quite right. Although there is not a lab in the hospital, they do have a nearby lab and work in networks. That was not the issue. The issue was the decision of requesting a dengue-related lab, depending on whether they thought it was dengue or not. Great, thank you. So we have 2 more minutes for this section. There's another question that might be answered by everyone as well. Which opportunities did you have to learn from the projects during the research process itself? Who would like to start? I can start. Well, the opportunities were ongoing and they're still ongoing. Actually, the teams know each other. Oh, sorry, we met throughout during the course, but we learned so much together. We shared our visions from our specific perspectives. We had ongoing interaction. We exchanged information, knowledge, and we stayed in touch all the time. And this has allowed us to learn from each other a lot. And this is unfinished work. It does have consequences that still affect communities, services, and there's still an exchange of information between universities, and it's really fruitful, and it's not over yet. Thank you. Dorian, Elizabeth, 1 minute for you.
Well, in our case, one of the opportunities we had was that we had a wide variety of interventions we could use because we have adaptation to each, or tailoring to each of the cultures. So there was this huge variety of possibilities. And right now, we're bringing down to earth, working on a roadmap and being able to work with decision makers. The fact that they brought us to this dengue team work, that is wonderful because it opens a possibility of working with the state or the government entity. Yes, between the teams, having an agreement between the universities for collaboration, that opens the doors for professional exchanges between universities for the teamworks. And we can also continue growing our knowledge. And the transdisciplinary work also enabled us to share with other teams. We were able to work with Cuba's team. We have Jasenia, who will be presenting right now. We became friends from sharing for so much. We can't, we are not getting Elizabeth. She seems to have frozen. Oh, okay. Elizabeth, do we have you back? Yes, I'm back. I don't know where I was cut off, but what Doriam said is fine. Yes, it's really important what you were saying. This is basically a transdisciplinary work. I think in your experience, this started, it has consolidated, and it will create many opportunities for work, not just for the countries that participated, but between all of these 12 projects, they will have something that is fundamental for collaborative work, that is having a framework. And the framework here is the transdisciplinary work, which, as you mentioned, requires many perspectives, but also being able to understand the language of the other person in order to build solutions for the challenges we are facing with climate change, health, and all the other variables. And so now let's move on to the second part of this webinar. I'm going to give the floor to Yesenia so she can present her early alert system in Cuba. Yesenia, good afternoon. Thank you, Hilma. I would like to thank the II, the Global Consortium, for organizing this space and strengthening this regional dialogue between climate and health. As the previous presentations showed, the climate, without a doubt, has a significant role, and it is still a challenge to transform the knowledge we have into actions and policy. And so the important thing, it's still a challenge to turn this knowledge into practical tools that we can use and in the field, and we need a proactive surveillance. And with that vision, we conducted this project. It's a pilot early alert system that is participatory and collaborative. It was implemented for 12 months in a municipality, doing entomological surveillance, among other things, with a transdisciplinary approach, including social participation, healthcare, in order to anticipate the risks. And it also took the community taking ownership of this system. I will tell you about the main results in the next slide, please. And this initiative was implemented in a territory in Jesus Maria, which has great social environmental complexity and has a high density of population. And so it has the conditions for this vector to be transmitted, and we see seasonal and recurring behavior here. And we use the indices that integrate the climate variables in order to have a space and time charts that are useful. We have some results of the multi-variable analysis we have that show the circulation of the virus. And this was the basis for developing our early alert system. Next one, please. With this integration of information, we were able to develop these operational tools. The previous one, please. Here. And as I was saying, we had this newsletter, this monthly newsletter on the climate that we focused. One was geared towards decision makers and the other one for the general population. So really taking into account the audience, using language that was accessible for them. And for the population that does not have resources, well, we wanted to tell them what they could do in their homes and anticipating preventive actions in the region, in the community. And so we had risk assessments, maps with forecasts, and maps showing where the virus was. And we have some comparative charts showing that cases decrease where these measures have been implemented. And so we show the coordination between the work between the meteorological information, community actions. And so at the beginning, at the middle, and the end of the project, we conducted surveys to measure the ownership of the community of this project and the knowledge, among other things. One of the main components was community engagement. This wasn't just a technical tool, it was a process of coordination and collaboration between institutions, the community, with awareness activities. We had some festivals to communicate the risks. We had actions presenting the response, the risks. We also presented the results. Next slide, please. And other than the results in the community, this also contributed to strengthen surveillance public policy and incorporated the climate dimension into decision making, integrated climate information, and the work between public healthcare and local governments as well was another result. And so this didn't just bring as an outcome data, but also better ability to respond to the situation. And so we intend to achieve sustainability and scaling up to other vulnerable territories, both in our country and anywhere else, assessing the impact to include other indicators. And to end, I would like to show this slide with the information, my contact details, the link where the PAHO link, where you can find information about our project. And I would like to end by thanking the collaboration from the II and the consortium for their help and support throughout the implementation. Thank you, and I'm here if you have any questions. Thank you, Yesenia. And now we have Mauricia and Bertha, the next presenters. And I would like to remind you to use the Q&A icon at the bottom of the screen to ask your questions there so that the moderator can access them more easily. Well, good afternoon, everyone. Welcome. Thank you so much for allowing us to present the results of our projects. Thank you to the IAI for implementing all of this. And congratulations to everyone who was a part of it. We dealt with a multidimensional vulnerability to dengue and diarrhea. It's an exploratory study conducted between Lancet Countdown Latin America, Bridge to Health, our healthcare organization, and the organization Orbital. So our project began with a concern or some research that was already being conducted between Bridge to Health and the Lancet Countdown. That has moved around different countries, Peru, Costa Rica, the Netherlands, the US, with a focus first on dengue and diarrhea first, But then as the project evolved, we have consolidated the regional and national approach in Peru to focus on this because of the situation with dengue. In 2024, we had 230,000 cases confirmed. And so the team has grown in Peru to focus on this, and also using this transdisciplinary approach, building spaces of collaboration with local authorities. And in Loreto and Caballo-Cocha, we have identified a point of interest to address this multidimensional vulnerability. And what we understand as multidimensional vulnerability is the vulnerabilities that come from social processes, political processes, ecological, biological, that are continuously interacting to cause a vulnerability to dengue and diarrhea. And so all of those issues and processes are very relevant in Caballo-Cocha. It's a city with 10,000 people, and you can see it in the dot in the map. It's a border city. It has a triple border there. And so there we have also all of the issues that a border city deals with. And so the objective for our research was to understand vulnerability through different scales, with the question of how does vulnerability to dengue and diarrhea changes when we combine national data, lived-in experience, and local community knowledge. And so we had this transdisciplinary and mixed method design is what we used. And we had a long period for literature review to find vulnerability indicators, and also to map the territory and the main stakeholders to involve, not just for collecting data, but also to fine-tune our research questions. And so throughout the research period, we were in contact with decision makers, but also staff that works in healthcare and people who work in the field to fine-tune our methodology. And we did our indicators with based on public data from Peru, public databases from Peru. We had a training, and we also had the knowledge dialogue. And all of that, throughout all of time, we had a co-creation of strategies for not just bringing visibility of the causes, the mixed causes of dengue and diarrhea, but also to work on mitigation. And so the mapping process and the interpretation of data, local data, was so relevant. And I would like to give the floor to Bertha, my colleague. Thank you. Well, we had 112 participants, including authorities, healthcare professionals, education professional leaders, and people from the indigenous people and some social organizations. And so we wanted to find the causes of this issue. We had government abandonment here, geographical isolation, extreme meteorological events, lack of safe drinking water, infrastructure deficits, unplanned urbanization, limited services for immigrants, occupational exposure, changes in the behavior of mosquitoes, illegal cultures, among others. And so we created an action plan involving improving infrastructure, among others. As for the multidimensional national vulnerability index, we need to acknowledge that dengue is a social and environmental illness. And so we need to take into account the infrastructure, the basic services, as well as the community culture, cohesion, and structure. And so we worked with the commitment of the communities to identify structural risks and think of how we can contribute to change that. And we had a really good response from volunteers, and we asked them help to reactivate a radio program that was called Intellectual Pleasure, as well as the community cinema and another project. And so I hopefully can show them to you when we have the debate and questions. All of the considerations about the ethical commitment we have to bring continuity and sustainability to this. Thank you, Bertha. It's really interesting, not just what you presented, but what Yesenia as well told us. And so let's begin with the questions. I have one that I think is more for Mauricia and Berta's presentation. Do you think that coordinating these actions allows us to create better responses to serve the needs of the territory? Also for
Local stakeholders were very important to make contributions to the solutions. It was very important for us that municipal authorities participated and confirmed their commitment towards finding solutions to problems regarding drinking water, sewage, etc. But these pilot projects are short, and it's very important to keep working in this regard to solve the problems. Great, thank you. Now I would like to ask a question addressed to Jasenia, sorry. How do you use meteorological updates in the case of dengue? Are you using these, do health services use these bulletins for decision making, and which were some of the decisions they made? What can you tell us about using these meteorological reports and the relevant interventions implemented by health services? Jasenia, I think you're muted. Thank you. That's an interesting question. And yes, the reports are used. It's one of the services that led to the project that are currently used, given the importance of optimizing resources, and also we need targeted interventions. In fact, for instance, in the May alert, these are monthly alerts, and in the alert issued in May, the vector department worked with the epidemiology department, and they prepared an action plan to strengthen surveillance and to act in particular in the areas where there was a high viral activity and its corresponding alert. Uh, of course, there are limited resources. And that means that we need to implement targeted interventions, in particular in the most problematic lots. But we do take actions. The participants visit the places where we forecast a high viral activity or increased dengue cases as well. We visit the homes, the households, and there is an intervention protocol and vector control in the areas. So the alert is issued and also used. There is a response and an action by the health department in coordination with the local government and local leaders. The project identified them, and we will keep working within these social projects. And the projects actually managed to create a TD team, as Elizabeth said before. And this really helps disseminating the report, and the response actions are still ongoing, although there are limited resources, which is a huge issue we have. So we need to maybe not take the best actions or with the coverage we would want, but we still need to take different actions regarding prevention, response, communication, and they are still taking place nowadays. Thank you. There's another question here. How did you develop the vulnerability index? Have you presented the variable categories used? They would like to know which was the methodology used to develop that vulnerability index and which was its result. We will share with you a link with a major finding, which is the publication of the paper, because describing the methodology, it was a TD approach with two experts in the team. One, they focused on the qualitative and quantitative experts, but if we were to explain all this here, would take us so much time. So we will be sharing you the link with you now so that you can read the paper published as a significant finding or output of the project. There you will find details and also annexes about the development of the index and its findings. Great, thank you. Another question for Chisenia. When you talk about climate variability in the exercise conducted to use forecasting information for the early warning system, are you talking about the El Nino or La Nina cycles, or what type of variability are you talking about? Well, to work with climate information, we use indices. We use the Balder methodology. These are climate indices that have been profusely published in journals. And they incorporate climate elements. So we incorporate climate elements and not fragmentary variables. Therefore, this methodology has a hybrid and flexible framework that allows us to integrate these climate elements so that we can actually get closer to climate variability, for instance, in biological living systems. So this methodology does not respond to one independent element, temperature, precipitation levels, but rather it responds to all these elements. This is why we use this approach, including complex indices, climate indices, in order to have a better understanding of that response of pathogens or people as well. So we used this methodology, which also includes the forecasting models used to have early forecasting. So this is the methodology we used, basically. and this allows us to express this kind of climate variability. The indices also work with, also include information about the Ino and El Niño and La Niña. Thank you. One final question for Maurizia and Bertha. Which was the connection between dengue and diarrheic diseases addressed in the study? Did they increase in a similar way, or were they independent in their incidence? Yes, I can answer that question. In the index, we had two unrelated variables. However, from a local perspective, there was a connection. So that was also a finding of the study. Berta, would you like to add something to that? Yes, within the structural courses and the conversation of different types of knowledge, fresh water, a lack of drinking water, and water storage were major causes of the problems, always in connection with living conditions and environmental issues that are now more severe in the area. Climate change and extreme temperatures were also acknowledged as central causes of both problems. And also what we mentioned on the slide, and these have to do with infrastructure, sanitation conditions, and waste management. Just one more thing. Actually, the vulnerability index led to a disconnected pattern, but there are also regarding diarrhea, there was higher dengue incidence within the jungle. However, people felt that dengue was much stronger than diarrhea and more prevailing than diarrhea. So it's just an example of the differences between dengue and diarrhea and between the national indicator and the local perception and reality. Thank you. Thank you. Thank you to everyone who has asked questions as well. Maybe now I would like to ask a question to everyone. And then we can go on to the next agenda item that has to do with your policy briefs. Regarding your experience, which capacities have the teams developed that will allow the projects to be sustainable over time? Because as most of you have said, these are short-term projects that might lead to longer lasting work. But I think it's important to understand which are your new capacities as TD teams. So what could what could facilitate the persistence of these projects over time? And what have you thought about maybe developing your projects in order to have a 3, 5, 10-year impact? We have 4 minutes for that, okay? 1 minute each. And then we can start with the policy brief section. As you wish, you can start if you want. Okay. I would like to actually show you a slide. It won't take me more than a minute. But I would like to say that as a team, it was very important to respond to a specific request made by young leaders, adolescents that work with health education and Edikuna people. They talked about a radio program, community cinema, and educational activities, given the lack of resources. And it was very important to provide resources to them. And then we kept supporting the group in a way or another. For instance, regarding participation in the webinar, because we wanted to empower the next generation to have a resilient future. That was the main theme of the Risk Management Day in 2024. We need new generations to participate. Also, the group of adolescents participated in the second International Congress of Research into Health and Climate Change in Mexico. They participated in the patent protection and defense of social and environmental health for girls and boys. And they participated in the virtual COP30 panel challenges shared by the Triple Border. As you know, I work in the Andean Health Organization, and it's very important to share great news with you. Last year, ministers approved a new version of the Andean plan, Andean Health Plan in the three borders. So through this work, we know that we need to reactivate our efforts in order to conduct intersectoral work to solve the structural problems in the Amazon and the Triple Border. We're also undergoing an assessment process and regarding the Andean Plan on Climate Change and Health, and we will be presenting a new version that is to be approved by the ministerial meeting on the 12th of June. Both plans work on address community participation and intersectoral work, thanks to the methods that have been promoted by organizations. Thank you, Berta. Gustavo. Well, how can we promote the sustainability of what was started? I think that the main aim should be to promote the uh, horizontalization of teams by including this conversation of knowledges. We need to democratize knowledge, opinion, and the value of everything that is discussed with academic stakeholders, non-academic professionals, non-academic or community professionals. That is essential for the project to be sustainable. In our case, regarding responding to the problem in our communities. Welcome, Rocio, my colleague from Argentina. Maybe she wants to say something. We can't hear you. Good afternoon. So as Gustavo and Berta were saying, it was very important for us to mainly to strengthen the health system areas that are more exposed. For instance, in the case of social health uh, agents that do this daily work. With this project, they were able to truly participate in a research team uh, because, as we were saying, we needed everyone to be on a level playing field, creating questions and developing a project that leads the system that needs to work with patients. And this allowed us to address different sectors, to talk to physicians, patients, different health stakeholders. And at least in Argentina, we noticed that, at least in Tucumán, we noticed that there wasn't enough work from the academia provided to health systems. So they have a lot of information that hasn't been recorded, hasn't been used for a project or research questions. So we needed to shape the work that has been done so far. I think that that's an installed capacity that we have now, and they are now more empowered because they can now implement a research project. We need to break away from the notion that just the academia does research. They are now doing research. and we need an output for this. And of course, the project will remain sustainable. Thank you. Thank you so much, Rocio. Okay, we're taking a bit more time, but it's very important to hear what you have to say because you did the work and you're there on the ground. So, Yesenia, very briefly, please. In Cuba, we have strengthened the technical and scientific capacities that have allowed us to make the system sustainable regarding data integration, risk communication, including the society and local leaders. That has been a strength. Also creating climate and health promoters and training programs for children, primary school children, also older adults, women, primary school children. We organize education festivals where they were the main participants and they would explain things to the population. Therefore, there was a strong connection between the health sector, science, and also the community. Regarding the local government, they organize a specific activity in every relevant institution. And they also organize a specific panel systematically where they take decisions. And these meetings take place every Thursday. And they decide on the information received. It has been a great opportunity. Thank you. Okay, thank you. Great. Dorian and Elizabeth. Well, we are now already working with the second project because we're implementing the intervention. We are trying to uh, find funding. So we welcome any contribution and help. We're working with some churches, and I think that many institutions really help us regarding their credibility in society. Great. Thank you. Thank you so much, everyone. So now let's go on to the next agenda item. Congratulations to all of you. I really love to see this process of working to make projects sustainable. I think that, as some of you have said, we must work with young people, adolescents, because if we don't, actually, we need new generations. Otherwise, this process will be very difficult. Will not be sustainable. So now I would like to give the floor to Daniela and Irene so that we can go on to the next section to talk about your policy briefs. Thank you.
Thank you, Hilma. Well, I would like to briefly tell you about, if you're seeing my screen, I would like to tell you that as a part of this series of webinars on health and climate, and based on the reports from each of the projects, we made these policy briefs. And the purpose of these briefs is to synthesize the main scientific findings with clear, accessible messages for decision makers, for healthcare professionals, local governments, local organizations, and other stakeholders working in the nexus between climate and health. These are very summarized, including information about the objective, what was done, the main findings, some key lessons, and a brief message for decision makers. And also information about the publications that are an outcome of the projects. And the purpose is to have more integrated and regionally relevant initiatives. The briefs are available in Spanish and English in the website of the AIII. And as part of this regional effort to strengthen the dialogue between public policy, science, and thank you again to Irene Torres and the communication team of the II and all of the project members for giving us the supplies to build these briefs. And I would like to now give the floor to Omar and Daniele if you have some closing words. Thank you. Thank you, Daniela. Daniele, do you have some closing remarks? Thank you, everyone. Thank you, Daniele. Well, I think this first webinar really shows the influence of climate and its dynamics on illnesses that are climate sensitive, that are sensitive to these changes. And we have a need to integrate the efforts that goes beyond the technical, the academical, the sector, because the experiences shared by these four projects definitely show that transdisciplinary work and the integration of knowledges is vital to strengthen the public management of prevention, surveillance, and action faced with the challenges posed by climate change with regard to this illness, but with other illnesses as well. And so with this joint interdisciplinary, transdisciplinary work, working jointly as teams, bringing the active participation and engagement of communities, we will be able to have innovative actions to protect health through climate change. And so I would like to thank the work of the II, the researchers, Bertha, Mauri, Rocio, Gustavo, Doriam, Eli, Jasenia, all your teams that are also behind you. I would also like to thank the work and support of Daniela for making this series of webinars possible. Irene as well, who has also been working on the communication side to make this possible, and also on the policy briefs. And so I would like to thank all of you, also to our colleagues from the Colombia Consortium for your support in this initiative. And so I would like to say goodbye to everyone by thanking you. But before leaving, I would like to announce the next webinar that will be on extreme heat on July 25th at the same time, 11 to 12:30 Panama time. And so we hope to see you all then. Thank you. Thank you. Thank you. It's been a pleasure. Thank you.